Asthma. It's not just an inconvenience for those who suffer from it. Asthma can be serious and life-threatening. In fact, more than 27 West Virginians die from asthma every year. And our state has one of the highest rates of asthma in the nation. In West Virginia alone, it's estimated that 123,000 adults and 31,000 children suffer from asthma. What exactly is asthma? Asthma is a chronic lung disease that affects your breathing. During an asthma episode, it's difficult to breathe. The airways in the lungs narrow and get blocked with mucus, making it difficult to breathe. Those who suffer from an asthma attack can feel as though they are breathing through a small straw. Asthma symptoms include coughing, wheezing, shortness of breath, and chest tightness. Asthma sufferers can experience attacks ranging from mild to severe and even life-threatening. Asthma cannot be cured, but if you have asthma, you can control how frequently you experience its symptoms and discomfort by knowing common asthma triggers, such as pets. Pets with fur or feathers can trigger asthma. If your pet is causing intense asthma symptoms for you or someone in your home, remove the pet from your home. If you decide to keep the pet, it's important that you keep it out of the sufferer's bedroom and clean weekly. Mold, pollen, and grass can also cause an asthma attack. Common areas for mold to form are in kitchens, bathrooms, and basements. Clean these areas often and make sure they get good air circulation. Strong odors and dust mites may trigger an asthma attack as well. Dust mites are tiny, invisible insects found in mattresses, pillows, carpet, upholstered furniture, and stuffed toys. Be sure to clean these items regularly if you have an asthma sufferer in your home. Bedrooms in particular should be regularly cleaned for an asthma sufferer. Strong odors such as perfumes, paint fumes, and household cleaners can also trigger an asthma attack. Weather changes, strong emotions, and exercise can cause an asthma flare-up as well. Exercise is good for everyone, including a person with asthma. In fact, a strong, healthy body can help combat the disease. However, if you have asthma, you need to take the necessary precautions to ensure that you do not experience an attack. What causes exercise-induced asthma? When you engage in any form of exercise, you breathe faster and often inhale through your mouth. Breathing through your mouth causes the air to be cooler and drier, which can cause an attack. Sports that are played in cooler air or outdoors near allergens such as smoke and pollen can make the asthma symptoms worse. Using your rescue inhaler 20 minutes before exercising and taking precautions to control symptoms will help. And finally, smoking and secondhand smoke can cause an asthma attack. Tobacco smoke causes the airways to become inflamed and affects the immune system. This can make it difficult for the lung tissue to repair itself. Secondhand smoke can cause asthma in children who have never experienced any symptoms. Children suffering from asthma and living with a smoker are more likely to experience severe asthma attacks, take more asthma medicine, and miss school more often. If you or someone in your home has asthma, smoking should not be permitted in the home. If a family member insists on smoking inside the home, air out the room by opening windows. The asthma sufferer should keep away from the smoke as much as possible. Many products and methods exist to help a person quit smoking. The West Virginia Tobacco Quit Line can also help a person quit. The program offers free to low-cost services that include informational materials, counseling, and phone coaches to assist a smoker in quitting. While avoiding major triggers are important to asthma sufferers, the right medication plays an important role as well. Appropriate medication can help in avoiding asthma attacks and allow the sufferer to lead a normal, active life. There are several drug delivery devices that can be used if you have asthma. The most common devices are metered dose inhalers, dry powdered inhalers, and nebulizers. The most commonly used delivery system for asthma sufferers is the metered dose inhaler. This device delivers instant medication to the person's lungs and should be used with a spacer. A spacer or holding chamber helps you to breathe at your own pace, allows more medicine to reach your lungs, and prevents medicine from escaping into the air. Dry powdered inhalers are another method. This delivery system consists of a fine powder inhaled by the user. Dry powdered inhalers can come preloaded with the medicine inside. Other dry powdered inhalers require putting the medicine in the inhalers every time it is used. Many long-acting controller medications are dry powder inhalers. A nebulizer may also be used by a person with asthma. With this method, the medication is made into a mist by compressed air and then inhaled by the person with asthma. Nebulizers are used for a specific medication, for more serious asthma attacks, or for other chronic respiratory diseases. Due to the severity of the disease, doctors usually prescribe a metered dose inhaler because they are more convenient and portable. Oral drugs and injections can also be taken by an asthma sufferer, but are not as common. Most asthma sufferers can enjoy a normal and active lifestyle with the disease if they follow their asthma action plan and self-management recommendations. Although asthma triggers can be different for each person, self-management consists of identifying what factors trigger your asthma flare-ups, anticipating and controlling your particular asthma triggers, and taking your medication properly. Asthma sufferers can monitor their airways by using a peak flow meter. A peak flow meter measures a person's ability to push air from the lungs quickly. All asthma sufferers should have an asthma action plan created by their doctor. The asthma action plan is a detailed plan that instructs the person with asthma on what medications and steps to take based on their symptoms and peak flow rates. Although asthma is a lifelong disease, it can be controlled. The more you learn about the disease and how to personally manage your symptoms and flare-ups, the better you can enjoy a normal and healthy lifestyle.